And today, a bird's eye view into reading. Part A. Welcome back to Edu Skills. Happy morning. And our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing the channel. Give us a thumbs up if you like our work. Please share the video to your contacts so that we reach out to maximum number of OET aspirants who are struggling to crack OET, especially those who are financially struggling to crack OET.
Reading part A, step 1, skim the 4 texts and write down a heading for each text. Skimming for 4 text headings. First one, text headings given for text A, B, C and D. Most of the text given to you, there will be a heading for each text. There will be a common heading. Then each text A, text B, text D, C and D will have separate headings. If not given, read and summarize. If the headings are not given for each text, you have to read and summarize. Means section headings have to be taken note of. If there are some subheadings, main heading will not be there, but there will be classification types or something of that sort. So look at the section headings and subheadings. Now the third option, if no text headings, section headings and subheadings are given, sometimes, very rarely, no section heading, no text heading, no subheading, just paragraph is given, if at all. What you have to do? Read the topic sentence. Topic sentence, that is normally the first sentence of the text, and you will understand what is the gist of the whole text. Fourth option, if a table is given, look for table, section or column headings. Look for the table, section or column headings. There will be horizontal and vertical columns. There will be some headings just above the columns. Just look for those headings and subheadings.
Now, for skimming part, you need to just look into this is first test A, speaks about the definition or description of the thing. The subheadings you have diabetes, type 1, type 2, gestational diabetes, pre-diabetes. That's all you need to look into in skimming.
Yes, sir.
Text B, clinical assessment, I told you, it speaks about symptoms here. Then you have CGBT, then further investigation to confirm diagnosis. That's all text B. Text C, managing diabetes. Okay. Then you have the management part of it. Then you have monitoring a person with diabetes. Okay. What is to be done? The focus of your reading in the part 1 should be this. So definition, then the clinical assessment, management, monitoring. Skimming in the sense you just see the headings, subheadings, and the title if there is title, headings, and subheadings. For example, this could be the subheadings, clinical assessment, management, monitoring, or whatever. This is management. This could be the headings and subheadings. Step 2, read question statements 1 to 20 and highlight the keywords and match each question with the related text. Without reading anything, let's see how you can work out. Now let's see, this is first questions 1 to 7. The first one is description or definition. A. B is clinical assessment. C.
Management.
D.
Monitoring.
So how do you think? Annual eye screening, where it comes?
Clinical assessment. B.
Yes. Clinical assessment. See, it's what precedes diabetes, precondition of diabetes, where it comes?
Definition.
HB1AC, HB1AC.
Clinical assessment.
Yeah, insulin replacement. Administration.
Management.
And habits needed for good diabetes management.
C.
Ultimately, you have their management, no? Already you have the answer there.
Yes,
yeah, habits, good habits. And most common side effect.
D.
Exactly. And the indicators that a person might be diabetic. The indicators mean symptoms.
D.
How many seconds you require? How many seconds do you require?
20.
Yeah, you need not even 5 seconds for each answer. Okay, now try reading these questions without. We are not going to the text at all. Let's see how far you can identify the thing. What is the prevalence of diabetes?
What is the prevalence of diabetes?
What are they expecting there? Don't tell me the answer. What are they expecting there? A number, name, or number. Okay. Yeah. Which organ is not working correctly, leading to diabetes? What are they expecting? Which organ?
Organ.
Any idea for you?
Noun.
Pancreas.
Pancreas.
Yes, okay. Don't, now I am going to teach you another experiential method, okay? Another method. Whether it is right or wrong, we will check out
We'll
when
see
you go to the
later.
passage, okay?
Sure,
Yeah.
sure.
So which organ? From that itself, that is called skimming the questions, okay? Which
Okay.
organ? So,
Okay.
the answer must be an organ.
Yes, sir.
Other one, the should be a number. Now the third one,
What is the
What is
most
the most usual treatment approach?
they are asking for what type of treatment. Answer most usual treatment. They are asking for a type of treatment, okay?
Yes, sir.
And next one,
How
fourth one.
often? How often is it appropriate for a woman with gestational diabetes to test her CBGT if she is taking oral medication? Maybe time.
How often? Time means daily or once in a week or once in 3 months, once in 6 months. You know what is the nature of the answer going to be.
Yes.
And definitely you know where it will be. Like,
Yes.
under the 4
Yes.
headings. Then next one.
How are the most common effects of having diabetes monitored?
Yeah, already you know where which text, monitoring. Okay?
Yes. Yes.
Common effects. You have to find the common effects there.
common?
If a person cannot keep their blood glucose level stable, what device might they use to administer their insulin? What is the device? We should find out.
One device. They are asking for the name of a device.
Name of the device.
Yes.
And it is singular. Mind it, it is singular. They are not asking for devices.
Device is-
Singular.
Device.
Singular.
Yeah.
Okay. And they trick you most of the time. There will be 2 devices or 2 things given. You will be writing
Okay.
both. And your
Okay.
answer will be right, wrong. You will be
Wrong.
tricked that way. So they should know whether you can identify the singular and plural form.
Okay.
Okay. So that's a trick they usually play. And which type? Next one.
Which type
Which
of
type of
diabetes?
diabetes can be prevented by making changes to diet and taking up an exercise regime?
Yeah. You know, actually, for which type of diabetes out of 3? Type 1,
Yes.
type 2,
Type 1 gestational.
You have to say, yeah, you have to just search for one. And
Yes.
where you have the word diet and exercise.
Exercise.
Okay. So next one, 15 to 20.
Number,
Maybe the number.
numbers. Result.
Number, yes.
And
Okay.
higher.
Number. So when you skim through the text, you need a number there.
You need the
Number,
digits.
yes.
Yeah. Once you know which text it is, which test, and
Then
what is
where-
required, number means you have to look only for number there. Nothing else.
Numbers.
Yes.
Yeah.
Yes.
Next one.
A person with diabetes out to see a doctor if they have a cut to a dash.
Yeah. Cut to a what? Where should they have a cut in the legs or arms
Leg,
or eyes or
arm.
a head? Or,
Yeah.
So definitely you have to answer, look into only that one, that particular thing. Then next one.
Diabetic eye screening is a half-hour long eye dash that can pick up an early signs of damage to the dash in the eye.
Monitoring. We have to see
Yeah.
for the monitoring.
Okay. Fourth one. I'm not saying right or wrong. Let's come back to that. Yeah.
A routine diabetes check involves pulse and blood pressure checks, urine analysis, and a dash test.
Investigation.
And monitoring.
Yeah.
Investigation.
Okay. Fifth one.
Type 1 diabetes is most predominant in children and adults aged with
Yeah. What is the age? Number. Again, number.
Definition. Age is
And type 1 and a number.
digits.
Yes.
Yeah. Definition.
Type 1 diabetic patients check their CBGT before dash and administer an amount of dash based on the CBGT.
Invest.
You know,
Amount
yeah,
of
usually before where do you use? Before in the medical term? Before the meals, after the meals, before
Yes, sir.
supper, after supper. And administer an amount of how many doses? 2 tablets, 1 tablet.
amount
Okay.
of, yeah.
And on the
CBGT value.
okay, whatever. Yes. So you see, this is the whole thing. We haven't read the text at all. But you exactly know where the answer is. Right? So we are just going into the text. Okay, step 3, skim the 4 texts and highlight the clues. Now you'll be skimming the text. However, if you want to skim the text earlier with the headings, when you find the headings, there itself you can do it. If you're competent enough, you can just skim together and highlight the keys as well. Skim 4 means highlight. Names. Already we have done with the headings, subheadings, and title. So other things, names or abbreviations of condition, medication, organ, test, symptom, device, all these names. Numbers or percentage, symptoms, time or duration expressions, sequential expressions, frequency expressions, scale, adjectives, conjunctions, negative expressions. Highlight the text. You see, first one should be, you should be able to take this text C and this idea should be there. You know, as you've gone through, type 1 is the indicator for so many answers, right?
Yes, sir.
Age
Age
under
under
30. Pancreas cannot be prevented with diet and exercise. Type 2, strongly linked to being overweight and having lifestyle exercise, lifestyle changes. And most common side effect. Whenever you use most, when there is a superlative, usually there is an answer or an adjective, high, low. And going to the next one, see, clinical assessment. The word symptoms, indicators. Then all the tests will come here. Urine analysis, check pulse, blood pressure, CBGT. All these are the things there. Once symptoms means this list is about symptoms. You need not go to everything. Only way if they have asked for a particular symptom, you can go there. Oral glucose tolerance test, the number you require and the test name. Now again, managing diabetes. What is the most common medication? It's oral medication. Then you have the insulin. And device was asked.
Pump.
Or using pump. Yes. And the fluctuating blood glucose level before meal. CGBT before meals. Yeah, when there is a chronological approach, usually there is an answer. Before, after, next, another. All those chronological expressions, or less frequently. Through an insulin pump.
Device.
Yes, device. Annual diabetic eye screening. Annual means already chronological expression is there. Yeah, damage to blood vessels in the eye. HbA1c levels should be maintained below 7%. Appointments with the doctor. Cut to a left blister or a graze to a lower limb. The caution here is you have to write exactly same words in form, tense, and number. Anything that transformation is done, that answer will be considered wrong in part A. You have to exactly take the answer, take the words from here, from the text, and write it in your answer. So these are the answers. First one we saw within few seconds we could manage that, right? You can manage this within 7 seconds, definitely.
Yeah.
So all these number, you wanted a number,
Yes, tolerance test.
and number is here. And which limb, lower limb, which, and the eye screening is half an hour long eye examination. And early signs of damage to definitely an organ, it should be an organ, something, blood vessel. And here you see there is a tricky answer here. If you write CBGT, that is wrong.
Okay.
Why?
Yeah, CBG.
Because it is CBG, not CBGT.
Yeah.
Because test is already given there.
Yes,
So usually, normally what happens, you will find it so easy, you will write capillary blood glucose test, the whole thing. The answer is wrong. These are the tricks they play with you. You got it, already test is given in the question itself. So you have to write only these 3 words. Take a caution of those things. But sometimes you feel it was very easy, but you have a lower score because of these things. These are tricks you should defeat. Okay? Is that clear?
Yes, sir.
Yeah. And part 1, never ever change the form, never ever reduce the word or number or change the form of anything. Exactly pick, collect, cut and paste. Just collect the same word and write in the answer. Any one spelling difference or spelling error, typos will be penalized. Type 1 diabetes is predominant in children and adults aged under, there is a number required which was under number, have it there. See, before meal and administer an amount of insulin based on the CBGT value you set, but it is result almost same answer. Okay, but then you'll have to get the same word from the test. Is that clear?
Yes, sir.